joins us now to just break it all down. First, thank you for joining us every Thursday, Dr. Quinn. So tell us, what is arthritis for those of us who don't know about it, and how does the problem usually present in your patients?
Well, I'll tell you, a guy who knows all about it. It's far too much more than I'd like to. Me. And as you said in your introduction, it worsens with age. And I am getting older, and I am a runner. And people that run, they put a lot of stress on those joints. When you run, every time you run, it's like hitting those joints. And the deal is, what happens is over the years, for all of us out there that run or we walk, or maybe we just do daily activities like go to work and we walk to our car. Over the years, some of that cartilage that's in those joints is going to wear and tear, and you're going to have something called arthritis. And it can be very painful to your knees, to your back, to your shoulder, or any of your joints. And that's basically what arthritis is inflammation in those joints, usually from wear and tear over the years.
So how do you diagnose it, Dr. Quinn?
Well, basically, it's a diagnosis that's made partially with the patient history. They'll come in and say, Dr. Quinn, my knee is hurting, I'm a runner, or I walk, or maybe they're a little advanced in age, maybe 40 years or older. Then you would just give the diagnosis based on the history of arthritis of that knee. Now, there are different forms of arthritis, and to get into that, we'd probably refer them to a rheumatologist, but they'll do additional testing to determine specifically what arthritis the patient has.
So when do you usually refer a patient to a specialist?
Well, what we do in primary care is we try to do the least invasive, least expensive, most conservative treatment possible for a period. So what we'll do is we'll probably put them on non-steroidal anti-inflammatory medication such as ibuprofen or naproxen, which is Motrin over the counter, and then we'll give it a trial of 4 to 6 to 8 weeks and bring them back. And if it's gotten no better or got worse, then we probably refer them out to a rheumatologist or an orthopedic surgeon so they can do some more invasive testing and more aggressive treatment.
Tell us how viewers on 12 News at Noon can manage arthritis.
Right. If you have pain in your knee, before you even go to the doctor, maybe give a trial of over-the-counter non-steroidal anti-inflammatories such as ibuprofen or Advil, and just see if it gets better in 2 to 4 weeks. And make sure it's safe for you. Basically, you can call your doctor and let them know what's going on. Maybe their nurse can look in your chart, make sure you're not allergic or any contraindications. But if it doesn't get better, go ahead and see your doctor and have that conversation.
Absolutely. If there's one thing that viewers watching right now can take away, what would you like that to be?
Well, just maybe try over the counter, but first check with your doctor's office to make sure there are no contraindications for, say, Advil or ibuprofen. But if it doesn't get better in 2 to 4 weeks, go ahead and visit your doctor and have that conversation. Unless the pain is severe initially, then go ahead and see your doctor.
Absolutely. Got to get it checked out. Thank you so much, Dr. Quinn. Appreciate your time.
Hey, thank you.
All right, Roberta.